Alrighty, let's go ahead and get started. Thanks for joining, everyone. My name is Kevin Phillip. I'm the communication manager here at Crisp, and I work as part of our user engagement strategy team, head up by Jessica. We also have my two colleagues, Glennis and Laura, who work as part of the team as well. Today, we'll be talking about Crisp clinical application called InContext. You may access this through your EHR. You may access it through the CRISP web portal. Either way, we'll cover the content that you need to use the tool to the best of the ability there and understand what the data we have available and features within the tool are, as both kind of ways you access the tool operate the same. Before I jump into the main presentation materials and our demo of the tool, I did want to cover some housekeeping items. So first, we are recording this session, and we will share the recording and the slide deck with all attendees. We also post those on our YouTube channel and our website, so you can go back and review at a later time or refer a colleague to review that material. This training is part of a monthly webinar series, a bi-monthly webinar series that we perform. If you are curious in upcoming sessions that we have, you can go to our CRISP website and then at the very top, click upcoming webinars, and you can see the options that we have for the rest of the month and the rest of the year. So typically we run these trainings every other month, but in the subsequent time, there are trainings on other tools like Population Explorer, one-on-one about CRISP, some new tools we have webinars for, like our clinical reporting suite. But you can find all of that information and those registration links on the website. We have all the lines muted just to avoid distractions as I go through the presentation. However, I do encourage questions. So if you have a thought, please use the Q&A feature, and we will have time at the end to answer your questions. I ask that you could keep the questions kind of open to and broad to be applicable to the rest of the group, rather than asking something like, I can't see that or my account doesn't show me that. I'm not going to be able to answer those questions on the webinar, but I'm happy to connect with you offline if you want to send me an email. My email address is my name, kevin.phillip@crisphealth.org, or you could reach out to our mdcommunications@crisphealth.org, and I'm happy to connect offline. All right, so with that, let's talk about the background of the clinical application called InContext. So as many folks here know, CRISP is the health information exchange for the state of Maryland, which means we both send and receive data from many participants within the healthcare space within Maryland. We're connected to all Maryland hospitals and health systems. We do have feeds with LabCorp and Quest for participants who send us lab forms to make that connection. And we work with the state and payers to receive claims data and public health data. And we kind of combine all of that to create one single record for patients that can follow them across any healthcare space that accesses CRISP. So using the data exchange for what we receive here, we can send back that data to various access points. Typically, users will be either accessing this information through their electronic health record or through the CRISP portal. Um, the difference is the health record is kind of an embedded widget within your EHR. So it's going to show information for the patient that you already are looking at through your EHR. Rather, the CRISP portal requires you to perform a patient search. The patient search is open to anyone, any patient who's on your panel, but you can even search for patients who are off your panel. The system will just ask you to kind of verify the reason why you are accessing them, whether they're a new patient or other HIPAA covered reasons that you might be accessing their data. So that's kind of the difference between those two. The other difference I would say is the CRISP portal allows you to access other CRISP applications, not just the clinical data or the InContext tool, but rather you can access any other widget that CRISP is offering through that platform. And so InContext is our clinical record, clinical data application. And again, we embed it into EHRs if it's compatible with your EHR, or you can access it through the portal. And essentially, users are using it to see information typically that are not present in their current EHR or what their current knowledge of the patient is. Here's an overview of the different tabs within InContext. So we like to break the data kind of by categories of type of data source. When we go to the demo, we'll talk through all of those in more detail. But at high level, patient information is going to be where you find demographics. We have a whole section dedicated to medication management. Um, Other clinical data are broken up in the clinical data tab. This is where you'll find things like immunizations and labs, as well as specific clinical documents, also known as CCDs. In care coordination, you can find the patient's care team. So other members who might be performing care for the patient might be listed there. Claims data and social need data are also tabs as well. And then we'll cover what my patient summary is, but essentially this is a customization feature that allows you to kind of take bits and pieces from all of these different tabs and put it into one dashboard if you are always constantly looking for the same information through the tool. So what are some reasons that a user might be using CRISP InContext? You might be a physician who has to prescribe a controlled substance, and you need to check the PDMP and the full medication history of the patient to do that. You might be reviewing a patient's chart and need additional information regarding a recent encounter that they might have had. Um, you might be a nurse, and when a new patient arrives with no medical history, you want to know what has this patient experienced before in terms of their medical history outside of just what is present in the EHR. So those are a few of a very many list of reasons why you might be using the tool. Um, I think that's all the background I wanted to cover, so we can quickly now jump into the demo where I'll actually go through each tab and kind of show you how everything works. So give me a second while I change screens here. Alrighty. Okay. All right, so now you're seeing our CRISP portal. In the CRISP portal, to open up the InContext or the clinical information service, you first need to perform a patient search. So minimum requirements of a patient search is first name, last name, and date of birth. Oops, I think I mixed up this person's name. And don't worry, this is a test patient, so there's no PHI being showed in this demo. Um, what you'll get back is when you hit search is a match probability of the demographics to those sets of demographics that we have in our master patient index, which is how we kind of store all the pieces of data that we get on one patient to one single identifier. Typical experience is you won't get multiple search results, but rather probably the exact patient that you're looking for. But since this is a test patient, this is why they have kind of multiple different identities here that we use for various testing purposes. Once you have the record identified that you want to look at further within the clinical application, you can actually click into the record and then you can see clinical information pops up here. You'll also notice other applications that might take the patient's information um, also populate here that you can launch. But for now, in this demo, we'll be covering the in context or clinical information section. So once I hit that, in context will open up. It might ask you if there was multiple records just to confirm again the patient that you're looking for. And then I'm brought into the in context application. If you are using in context within the EHR, simply this widget would just appear in your EHR that you can click down further into to open it up to get to all of these tabs. Within the portal, once you launch it, you're able to expand the view by sliding this slider away. Essentially, these are the other applications available within the CRIS portal. And then you can also open up this slider here to see all of the tabs present within the in-context service. One thing I want to note before I get into any content is you notice that my um, application launched me to this My Patient Summary section. You could actually have the ability to change and customize the way the tabs appear and also the order of the tabs in which they appear. Um, so you can slide things up or down. Whatever is in this top section here will be your default landing page. Um, and one thing to note is the patient demographics will always stay as the top tab. However, it's not necessarily the default landing tab. So right now, clinical information, I just moved it so it will be where I land. I think by default, medication management is what it's set at. But again, in user settings, you can customize that by using these arrows to move things up and down. And then you have the option to save that. And so every time you search for any patient, this is the order in which the tabs will appear. You also noticed change that on the left side minus the patient information and apps. Okay, so I will start with patient information. It's the most straightforward section of the tool. Essentially, it shows the demographics of the patient. There may be additional contact information if we've received that data from any um, source that has performed care for this individual. And we may even have address if that is available. We also present any next of kin information here if that information again is given to us through CRIS participants. So these sections here, I guess, is ultimately what I'm saying is they may or may not be present for every single patient that you have, but bare minimum, the basic demographics will be filled out. I'll move down into medication management. In medication management, this is where you might see a varied experience depending on your access. So the first tab here you'll see is called PDMP, which stands for the Prescription Drug Monitoring Program. If you do not have access to the PDMP, this is where you would, PDMP essentially is where you would look to see if any controlled substances has been prescribed to the patient. Um, and if you don't have access to it, it would not present here, and it will have a banner that just says you don't have access to view this information. Um, the other thing with PDMP is there's an advisory section that kind of gives very um, key metrics regarding that patient's controlled substance use from their prescribed history over the past frequent time period. One thing to point out before I move off of this is most of the tabs in here are in a tabular format, and they all can kind of contain the same features. They have the ability to sort data, and you have the ability to search for data. the search is really cool because it will search all of the fields and you don't need to get the full text of the search exactly right. So, for example, if I search for CVS, it's going to pull back all of these CVS results. Maybe I should. It seems like a lot of the data here is there from CVS, so maybe I'll search for Walgreens. There we go. And you can see Walgreens is present in both of these columns, and it pulled back these. And then even better down here, you can see it was actually prescribed by Walmart and then fulfilled in the pharmacy by Walgreens. So you could see what I was kind of mentioning, that the search searches in all of these columns and then pulls back that keyword. I didn't have to get this co part correct. So you can use that to your advantage when you're searching for something very specific. The search works really well in all of these facets. Um, One thing to point out is some tables might have additional columns, and you can also customize the columns that you see. One thing I'll caution users about is if you do remove a column, the system will automatically save that as your preference. And so the next time you come back to that tab, that column will be hidden and it might be hard for you to know that that column exists. So I would just make sure if you do change this for any reason, you have a good reason to remove that and kind of come back to there if you are looking at a new patient and you need the most information. Filters are also available where you can filter in any of these columns. The date fields will allow you to select a from and to date, while the additional columns here will kind of pre-fill with what is available in the columns, meaning the patient has had been prescribed all of these things, and you can select which ones that you want to quickly see. Um, Any disclaimers will be present there in a kind of warning icon. So this is giving you some more information about how some of the advisories are calculated. Um, for the PDMP specifically, you can query other states. Right now, this is just pulling back connected it for your experience, it would just pull back Maryland, and then you can query additional states to pull back additional data. You can also download the table into a PDF format by hitting this, and I would say most tables in the tool have that option, if not all of them. There also might be a definition slider that gives you some more information about the current tab that you're looking at. So for this example, it's giving you information about those advisory section. Okay, moving off of PDMP, which you may or may not have access to two columns that everyone will have access to. There is what we call dispensed medications and then reported medications. Reported medications is broken out by the last 90 days and then all time. Um, the difference between these two are the reported medications are coming from CCDs or clinical documents that CRISP has received for that patient, while the dispensed medications um, recently, last year, the state mandated that all dispensers send medication data to CRISP. Previously, they were just sending controlled substances, and now they're sending non-controlled or non-CDS information to us. And so that is what this tab is. So it's possible that these two are duplicative, and our team is working to work through that, but it's important to know what the source of these information is. So again, reported medications is coming just from clinical documents received through CRISP, while dispensed medication is coming through any of the dispensed medication data that is flowing to CRISP from dispensers. Um, Yeah, so those are the difference between the two, but more or less they kind of have the same information across them. All right, I'll move down to care coordination. You'll see there's four tabs in care coordination. there is the care team, care alerts, referral history, and advanced directives. The care team will be any from sources for providers who are also taking care of that patient, and they may even have the role associated of their care. For example, you can see here there's care managers and primary care physicians listed for the patient. Um, and then if they are part of a care program for whatever reason, they might be listed there. Care alerts. So these are things that our providers and participants with CRISP might send to CRISP about the patient that they then want to kind of highlight for other folks who might be taking care of that shared patient. They might see things like they were tested for this or received this vaccination, they received this test, they might be experiencing this kind of need. Things of that nature our providers are sending to CRISP so that we can downstream send them to the rest of CRISP participants through this care alert section. Any referrals that are made through CRISP will populate here. I will note it's not all referrals ever made to any program for a patient, but rather if providers within CRISP have made a referral to a CBO that is using CRISP for the referral platform, that's what they would appear here. You can also see a status regarding that referral, if they've been completed, rejected, pending, accepted, enrolled, those kind of things. Advanced directives, any advanced directives that CRISP has received um, for the patient will appear here and also gives you the ability to open the document to actually see that advanced directive in full. One thing you might have noticed as I was going through some of the tabs is this slider that gives you the ability to hide your organization's data. The reason you might do that is sometimes folks want to use the CRISP clinical information to only see information that is not present within their EHR. Um, and view outside information only. Um, so using this slider can hide any information that your organization is sending to CRISP so that it's not duplicative of your EHR, but rather supplementive in terms of the data that's being shared. Um, Once you make this slider, it will kind of stick for that tab. So you'll see it in many different places as we go through the demonstration today. One other thing I didn't note as I was going through it, you might have noticed this bell icon or these three dots. I'll start with these three dots. They're kind of extra pieces of information. So in the glossary, you can find out more about the different icons or even the different data tabs that we have. We kind of give a brief summary of what is present in each of those. Um, you can send feedback to our team by clicking this, and you can fill out a form about any feature that's not working correctly or anything you are experiencing. We also have this about section so you can see what version you are running. Most likely not relevant to folks who are using the portal, but just something to know that that is available to find there. Priority alerts. So this is things like clinical alerts, so overdoses or um, infection control alerts will appear here. Anything that is kind of super important to know about the patient will appear right there. All right, now moving down to clinical data, this is probably where you will spend most of your time, and this is where you're going to find core clinical data that we are receiving in real time and transposing back in real time, almost real time to CRISP participants. So the first section here is called health records. It combines kind of three distinct pieces of information. So lab data, radiology, and clinical notes. You can kind of see that in the All tab, or you can go down into each of these sections and view more information. So in the lab section, we have two additional tabs or ways to see the data rather. The first is a traditional list tab table view. And then the next option is called this lab timeline view, where you're able to see data presented in a timeline format for a certain time period that you select. So you could select 3 months, 6 months, 1 year, 2 years, up to 5 years. I'm going to go ahead and click 5 years so you can see what this looks like. So what it's going to do is it's going to take the most recent lab value taken and then transpose that on the left side into these various columns. And the columns are broken out but by, I guess, lab category. This test patient doesn't have the best data for you to see this, but you can imagine if this 629 visit also had the same hematology done, you could quickly just view the delta of the values. Um, and we have iconery that shows if things are out of sort or out of value of the range provided for that specific thing. So the idea is over time you could see the change of the lab values if they're presented in multiple times. Again, this TIS patient doesn't have a great set of values to see that, but you kind of can get the idea. And I might even have some additional screenshots in my slide deck that I can show. All right, moving on to radiology. This is where you could actually see any images that have been shared to Chris through the image exchange, and you can actually view that image itself. So you can click this camera icon to view. This does sometimes take a little bit of time because it's loading from specific servers and the images are generally pretty large. So what I would recommend is most likely clicking load and then going back to the tool and doing things before that is ready. But I'll keep going through the demo before you can before that loads, and then I can or it can fail. I have a screenshot that I can show you in the tool that kind of shows you what it looks like. Basically, you can see the full radiology image for this specific section. You can also click down into the result, and you can see if any notes were given from the tech or the provider who was performing this test. You can also download that as well to a PDF through that widget. If you want to access all of the images for a patient, what you can do is you can click that button and move to this separate tool called the imaging work list. We have more information about the imaging work list on our website, but essentially it allows you to kind of look at up to four of these images all together at the same time. So if there are multiple X-rays done, for example, this 5/18 date, you might want to look at these three if they are different radiology images at one single go. So that is what the imaging work list does. It essentially brings you to a different platform to look at that information. I should have mentioned this in the lab list, but you can also do the same thing in terms of clicking down to see the notes and values of the actual lab being tested there. One other thing to say about labs before I move off of this is we most recently at CRISP have started to receive data from Exact Sciences. That's the company that has one of their products being Cologuard. So any tests done for Cologuard will also present in this health records lab section. So if your patient is doing those testing on their own, that data and those results will now appear in that section if CRISP has received those. All right, moving to clinical notes. So this is things that the providers are sending to CRISP. So clinical documents talking about a specific encounter or a treatment that they might have received, and you can actually click down and view that source document. Sometimes it will be nice, clean document like this. Other times it will be text, kind of depending on what the clinical document is for. All right, moving to structured documents. So these are things that are summary of an episode or a continuity of care document that organizations are sending to us. And you can, again, click down into view that information in more detail. And typically, these are very structured documents, so they have specific sections that you can actually click down into and view the information gathered for that particular section. So, for example, I clicked down to encounters and was brought down to this piece of information there. You might notice that some of these headers seem similar to the tabs remaining within the InContext tool, and that's because they are the same information. So our team's been working to kind of parse the data from these documents into specific tabs for folks to see at a very high level and quick glance without actually having to click down into these. Things like problems, immunizations, allergies, vitals, and procedures. So these 5 tabs here will come from one of these source documents here, but you can see them kind of presented all together rather than having to click through the various sources that they actually came through in these documents. The other thing you will notice about the structured documents tab itself is there's 3 sub-tabs. This all section shows all of the structured documents that we have. Any that have been sent directly to CRISP will appear in this HIE section, and then any that are being grabbed from out-of-state national networks will appear here. And then this icon is giving you a signal of the amount of records that are present within each of these tabs. So for this patient, for example, there's nothing out of state for them from national networks. But everything is coming from in the state of Maryland in CRISP itself. All right, moving down to encounters. This is where you'll see inpatient ambulatory observation and emergency room encounters. So all of the hospital-based ones will be here, so inpatient and emergency. Rather, the outpatient ones will appear here as well. You can't click down into anything here, but rather it gives you the basic information about their encounter itself. It looks like I had a column there with status hidden. Um, I'm not going to click through these 5 tabs, but again, this is transposing information that is available in the structured documents. The only tab that has additional information is the immunizations. Most of the immunizations here will be coming from Immunet, which is Maryland's vaccine repository that prescribers or dispensers of vaccines have to report to. So that will have more than just CCD information there. I'm going to skip my patient summary and then actually finish social needs data and then data from claims and then come back to my patient summary. So assessments. So these are any social needs screening assessments that have been performed by CRIS participants on that patient, and it will show you any abnormal results in the category of the social need that the result kind of refers back to. For example, this shows that this patient is experiencing food insecurity, and then it has some metrics about the questions that made that flag true, experiencing issues with housing, transportation, and utilities. So all assessments there will be shown, and you can click down to see exactly what that social determinant of health is referring to. Any conditions that have been reported in Z codes in the clinical data that we are receiving will also be presented here. So you can see what that description is for the Z code that that is referring to. Data from claims. So this is a little duplicative of the clinical data. However, the data source obviously is completely different. So clinical data is coming from the hospitals, health systems, and healthcare facilities that CRISP is connected to, and that data is in real time. Rather, the data from claims usually has like at least a 2 month lag. And again, these are the pieces of information that is being billed for and being paid back by insurers. So in the data from claims, you can find all payer hospital claims information, and then Maryland Medicaid and Maryland Medicare claims. And then we break out the by claim data by type. So you'll see medications, diagnosis, procedures, and encounters present there. All right, so now I will talk about my patient summary. You might have been noticing this thumbtack icon being very prominent in all of these titles. This allows you to kind of build your own custom dashboard that we call My Patient Summary. So if I navigate to My Patient Summary, I already have some pieces of information pinned to my dashboard. I have immunizations, care team, problems, structured documents, health records, another section of health records. So this is the notes, and this is the lab or radiology data, the labs, and then assessments. So you can have up to 8 pieces of data or tabs pinned here at a time, and you can move them around to your liking. But the idea is you saw we were clicking through many pieces of information, but as a busy provider, you might be wanting to get this information as quick as possible, and you only use CRISP to see um, 3 pieces of information that you want to kind of check. So you can use My Patient Summary to kind of make this custom dashboard, and this allows you to see quickly all of that information on the patient and all of the patients that you're searching. Um, Super fast without having to navigate through all of these sub-tabs to pull back that information. So again, to customize your dashboard, you would go to a section of data that you want, and you would click pin to the My Patient Summary dashboard. You can also unpin information. So for example, if I don't want the structured documents tab anymore, I can unpin it. It's going to move up the tabs that you had below. But then you can come to other data sections and add that to your My Patient Summary. Also, using the user settings that we talked about at the very beginning, you can make Patient Summary your default landing page. So if you do customize your My Patient Summary once with the information that you want to see every time you access CRISP, and you change it to be your default landing, you essentially could theoretically just come to this tab, and you can see the information that you want, and then you don't have to actually click through anything in context unless you wanted to grab more information, for example. So it's a way for you to customize your experience with the tool and allow you to see information as quickly as possible and eliminate some of those clicks that are needed to be done to pull back information that you need. You also notice within each of these widgets, I can still do things like search, which is great. So you can quickly kind of navigate the tabs a little bit easier if there is lots of data for the patient that you are caring for or looking for. My last section I will talk through is the app section. This is mostly important for users who are launching this through your EHR, because these applications are generally available within the CRISP portal here. But if you are launching from the EHR, this allows you to quickly jump to the things like My Directives or screening um, questionnaire for social determinants of health data. So allows you to quickly navigate from the patient portal or patient record to that information. Alrighty, I'm going to go back to my slide deck. I think I covered everything that I wanted to demo. Um, Let me reshare that. And we can finish a few slides and then I'll open it up to questions. All right. So this is what the radiology images looked like. We didn't get to load that, so I just wanted to give you a sense of once you click that camera icon, what loads there. So this is what that is. And then here are the various tabs that are parsing data from CCDs. Um, And then lab timeline view we talked about, and the Cologuard, they are there as well. If you need more information about InContext, you can navigate to our CRISP website, and there is a full page on InContext where you can find more information and more short form videos about the tools about the tabs and features within InContext themselves. And if you do have additional questions that we weren't able to answer today, you can reach out to our broader support line, support@crisphealth.org, or you can call our number there to have a representative answer your question. Speaking of questions, I will open it up to questions. So if you have any, you can drop them in the Q&A feature here or raise your hand and I can take you off of mute to ask your question. I believe we have about 15 minutes to cover questions. All right, I've asked this before, but it's been a while. Is there someone from CRISP able to provide a list of patients that have a care alert uploaded for a practice? We have a practice that wants to know all of their patients on their panel that have a care alert from their practice. That is an interesting question. I'm not sure if I know the answer, Cassandra, but I will ask folks on our team if there is an ability to kind of send data like that. It may be we need to do it through a different tool. Um, I'm just not sure if that is possible. If you could email me, I just sent back in the response to your Q&A the my email address so that you can reach out. All right. Is pinning my patient summary at the patient level or at the user level? So that's a great question. So anything you do in my patient summary will be saved to your user profile. So any patient that you search for, the the tabs that you had pinned previously will be what you see in my patient summary. I think that's what you're getting at with your question. So it saves to your user profile. So let's say you know exactly the 8 pieces of information you want every time you come to um, InContext for any patient that you search, those will be the ones that appear if you've saved them to your My Patient Summary. So you don't have to do it every single time for every single patient, but rather do it once for the user level And every time you search a patient, that's the one that will appear. How do we check if InContext app is live in EHRs now, or is there a registration process for InContext to be activated? Yeah, that's a great question. So, um, it is something that we have to work with your EHR provider to set up. Um, so if you are interested in having it in your EHR, maybe you can reach out to me and I will let you know if we currently work with your EHR vendor. If we don't yet, it might just be because we haven't had a participant ask us to work with that one yet. Doesn't mean we can't. So I would just reach out to us, reach out to me, and we can find out more about what provider you are currently using, and then we can walk through the steps to get that set up. There's no cost on the CRISP side to do that. However, your EHR vendor might charge you something to kind of go through the setup process of that. It depends on the EHR vendor, and I can't really speak to each of those individually. What is the status of including veteran admin hospital records in CRISP? Um, I am not positive, Christopher, but I can find out more information about our efforts with them there. Um, if you if you want to reach out to me again, I can note that I can follow up on that for you. Apologies that I don't know offhand. Seeing any other questions yet, but I will keep staying on, see if there are any more for another minute or two. All right, seeing no other questions, I think we can go ahead and conclude. Oh, right when I said that one came in. Okay. Do optometrists report diabetic eye exams for retinopathy to CRISP, or is that not required yet? Um, that is a great question. I don't know what our penetration rate is with optometrists to receive data from them. Um, I can find out more and maybe get back to you. I don't know of any regulation for that data to be shared. So my assumption, and again, it's an assumption that it depends on if we're connected and exchanging data with that particular provider, if we would have that data. Um, so I think that that one kind of depends on if we are set up with their office to exchange data or not. Great question. Alrighty. Thank you for attending the session today. And please reach out if you have any additional questions. Have a great rest of your afternoon. Thanks.